Respiratory syncytial virus. A 6-year-old boy there just died a few hours after being diagnosed with it and hospitalized. And a Montessori school system in Indiana just shut down for sanitizing, with about 40% of its school population out with RSV, flu, or COVID. The California Department of Public Health would not share any specific numbers of infections here or whether or not there's any effort to decompress hospitals in certain areas like it did when COVID cases were spiking. With me now live, Dr. Dean Blumberg, the chief of pediatric infectious disease at UC Davis Children's Hospital, to talk about the state of RSV right here. Good morning, doctor.
Good morning.
UC Davis not able to provide for me any specific current numbers or perhaps how they've increased over the last few months when it comes to RSV. What have you noticed?
You know, our hospital is typically full this time of year, but we do have capacity and we can manage a surge of patients. But we're certainly seeing an increase in the number of RSV detections and the number of patients admitted to the hospital for RSV complications.
How would you compare this year to last year when it comes to RSV? Is this maybe 10% more? Is it 20% more in your estimation?
We're seeing an earlier start to the RSV season this year than we typically see, and it's much higher also. According to the California Department of Public Health statistics that lag behind by a week or two, hospital admissions are up 80% over the previous week, and the number of detections are up 30%. So we are seeing an increased number of cases, and I'm afraid we haven't seen the worst of it yet.
RSV stands for respiratory syncytial virus. The Centers for Disease Control and Prevention reports between 100 and 500 children die every year because of it. So this is not exactly something new. The seriousness of it, not new. Why does it seem so vicious this year?
You know, I think this is a result of COVID and all the precautions that we took for COVID. So the lockdowns, the social distancing, and the masking. And that's left children vulnerable to infection. Pre-COVID, almost every child got infected in the first 3 years of life. Now we have a bunch of susceptible children, and it's really going through communities like wildfire.
The CDC says the country saw 5,845 RSV cases for the week ending October 1st. For the week ending October 29th, that number jumped to 7,679 cases. What does that say to you about where we're headed, leaning into the deeper winter months?
Well, not only are we worried about the increase in RSV, which is expected to increase even more in the next month or two, but also influenza is on the rise, especially in the southeast of the U.S. And typically influenza increases from the East Coast first and then travels to the West Coast. So we do expect more cases of influenza also, as well as COVID increasing over the winter.
Alrighty. Now, you were just talking about this. COVID protocols like masking have relaxed quite a bit. So experts across the country have pointed to that as the reason why we may be up against what's being called a triple-demic over the next few months: RSV, flu, and COVID. So that is really what you're seeing. Are you seeing people that have all three of those, or just that people are coming back repeatedly with one and then the other?
You know, I think it's the total impact on the population. Most people only get infected with one at a time, but all three are increasing at the same time. Occasionally, people can have co-infection, but typically it's only with two viruses at the same time.
Alrighty, and we know all of them can be serious and deadly, so definitely too quite enough. Young children and the elderly are the most at risk for this. What can we do to best protect ourselves, protect our families?
Well, for influenza and for COVID, people should be up to date with all vaccines, including boosters, as indicated. For RSV, there is no vaccine available yet, although the results are very promising with some vaccine candidates, and we might have those available next year. Masks protect against all three of these viruses, so I would encourage anybody who wants to decrease their risk of infection for themselves or their family to continue to mask if they're in crowded situations, especially out when they're inside and with people outside their usual household.
All righty, we do see a lot of people still wearing masks, but more might help. Thank you so much, doctor. We appreciate you.
Thank you. Take care.